standpoint. My standpoint of discussion is what's this going to do to your insurance, and how's the funding of care going to be different here in the future? Quick show of hands. How many of you currently have access to employer-funded health insurance? So a pretty strong percentage. So what I do day in, day out is consult with typically large employers on their strategies relative to employee benefits. So needless to say, over the past 3 years since healthcare reform has been passed, I've been consulting with the employers on how they're going to deal with what's coming, namely January 1 of 2014. So now the message for today is really how does this impact you individually? So I'm going to try to talk through some of the high points about what's changing, and then specifically give you some strategies that you can consider as you look to make your own decisions for you and your family. So the first thing we'll touch on, though, is the cost of care. Really, if you look at the healthcare reform law, which I perhaps as a glutton for punishment actually read, all 2,700 pages of it, it's really a bill about the funding of healthcare, and then there's lots of other stuff built into it. In fact, it's actually called the Affordable Care Act. So needless to say, the costs for care have been going up. I think what Leo said at the beginning is spot on. The subsidization that has occurred between the government programs, Medicare, Medicaid, and then private insurance has driven, among other things, the cost for private insurance through the roof. And this is a graphic that shows through 2009, and the healthcare reform was passed in 2010, what was happening to premiums. So as we walk through this, first thing I'll acknowledge is yes, healthcare has been very, very expensive, and it has been getting more and more expensive. Another problem that we had is that the unfunded liabilities for Medicare and Social Security have been going through the roof. You'll see to the left there, that was 2009. This is the Social Security and Medicare Trustees Report. The unfunded liability in 2009 when healthcare reform was passed was extremely significant. It was $379,000 per household, and projection, which holds true for today, is that in 2014, that per household liability is going to be around $500,000. So think about that for a second. That's the unfunded liability, which we as a nation are going to have to deal with one way or the other. Now, I don't want to be all doom and gloom, so I'll try to put some positive perspective on things where it's relevant. But one very important thing that you all need to be aware of, I presume everyone is that in 2014, so January 1 of 2014, you as individuals, assuming you're not living on an Indian reservation or some of the very few exclusions that are there, are going to have qualified health care. And if you don't, there's going to be a penalty. It's technically a tax, as we all learned when the Supreme Court ruled on it. Now, the penalty is very, very low. In 2014, it's only $95, and it ratchets up, so in 2016, it's $695 currently. But there's going to be a penalty if you don't have approved coverage. Now, for a lot of you, though, I saw all those hands, you've got access currently to employer-funded care. So, for whatever it's worth, I can give you a little perspective of what employers are thinking. When the bill first passed, there were lots of articles that were written, talking heads that were talking and saying that employers are going to be better off just dropping coverage. And one of the reasons I read the law is I wanted to see, okay, do I really think that's the way it's going to turn out? Well, the next thing you're going to see here on this slide is that there's an employer mandate. And this employer mandate applies to all employers who have more than 50 full-time equivalent employees. And there's a penalty to the extent they don't provide coverage. Now, needless to say, you saw the premiums that were on that slide a minute ago. As costs have been going up, employers have been shouldering more and more of the responsibility. And they've been doing so in the absence of any law telling them they have to. So what I've found to be very interesting is over the past couple of years, the discussion that I've been having with employers has changed dramatically. Prior to healthcare reform, the discussions were very paternalistic. Employers were providing coverage because they were doing so out of care and concern for their employees, desire to make sure that not just the employees but also the family members were protected. But as the law has passed, now there are these very heavy sticks that have been included in the law, so employers are now starting to look at, okay, we've been doing all this great stuff for employees, now how do we make sure we avoid it? And what is transpiring is employers are making sure that every way they can, they're going to avoid those penalties. Now that means, and this might be good news, most of them are going to continue to offer coverage. Because to not offer coverage, there's a $2,000 fine per individual. It's not a tax-deductible business expense, and frankly, you get nothing for it. You then release the employees to the exchanges, which I'll talk about in a minute, wherein they purchase coverage. But unless your incomes are below 400% of federal poverty line, you're not going to get a subsidy through the exchange. So you're essentially going to be buying coverage with after-tax dollars that you can get through your employer pre-tax. Now, we could talk for 3 hours about the whole employer strategy, and I don't have that much time, but what essentially is happening is employers are starting to transition to an effective strategy to just make sure they don't get penalized. Now, the good news is that most of you aren't going to see a whole lot of changes in the next year and the year thereafter. But slowly but surely, employers are starting to transition away from plans that pay, for instance, 80%, 85% of expected actuarial claim cost to plans that are now going to be government approved as being quality coverage at 60%. Now, what does that mean to you? It means that your deductible, if you've currently got a deductible that's $500 or $1,000, get ready, because it's going to be going up, which is going to pose more problems for Wellstar and other health systems, because while your premiums ostensibly will be coming down because you've got a higher deductible, your out-of-pocket cost is going to go up. Additionally, one thing that employers are doing is they're going to no longer be paying for dependent cost. So for those of you that raised your hands, you've got a really nice benefit plan. A lot of times employers are paying a very high percentage for employees and generous, sometimes 50, 60% for dependents. The law itself gives no incentive, based upon some of the safe harbors that are in the law, written in the regulations, for providing dependent care. So you're going to see a lot of scenarios where employers are going to stop paying for dependent coverage. They'll still make it available, probably, at least for dependents, they've got to. But there's not going to be the level of dependent subsidization that you've seen in the past. Now, that kind of all sounded like bad news, so I'll try to get to some good news. There are going to be exchanges that are going to be set up in 2014, January 1 of 2014. They're technically 2 government-type exchanges. One's for individuals to go to. The other is something called a shop exchange, which I'm not going to talk about, for small employers. That's what you've read maybe in the newspaper. It's been delayed a little bit. It's not ready. Not real surprised about that. You're also going to see some private exchanges popping up. But the exchanges, the government's going to be calling them marketplaces, it sounds like, are going to be places where you can go as an individual, and this is the good news. If you've been locked out of health care because you're sick, because you've got pre-existing conditions, because maybe you don't have access to employer coverage, you're going to be able to go to the marketplace, get coverage, and do so without having to answer any medical questions, without having pre-existing conditions and the like. That's good news. Bad news is the rates are going to be going way up. So for any of you, quick show of hands, how many of you have individual health insurance right now? Okay, so thankfully we don't do much of that, but for those of you that have individual health care that you purchase, rates are going to be going up significantly in January. Depends on which insurance carrier you talk to, but probably anywhere between 30, and if you ask United Healthcare, maybe up to 100%. Now, if you're on the older end of things, it may not be as significant. You might actually see costs come down, doubtful. If you're a younger person, you're going to see rates go up. Now, I'll get to one quick strategy for those of you. In the event you've got an individual plan, I'd highly recommend that you look, if you're healthy and can be underwritten for it, to renew a plan on 12/1, December 1st of 2013. By doing that, you're going to be able to lock in rates that are not going to be impacted by the community rating that takes effect in 2014. In particular, also very small groups, so if you have less than 50 employees, a number of healthcare carriers are coming out with strategies where you can sign up, get your renewal, kind of pre-fund your renewal for 12/1, and have essentially a 1 year, even a 2-year rate guarantee. So there are some strategies you can use to try to avoid it, but long story short, rates are going to be going up in the individual market. It's for the most part because the carriers can't underwrite the risk anymore. Now, there was a temporary high-risk insurance pool. It ran out of money pretty quickly. There's some political wrangling around the funding of that. But at the end of the day, down at the last bullet there are some common limits, and this is the good news. You've got no lifetime limits and a lot of other things that are going to make coverage really nice and strong. The problem is it's expensive. Now, employer provisions, not going to spend a lot of time on this because this is more of an employee discussion, but a lot of things are being forced on employers, requirements that the coverage they offer hit certain minimums, as I mentioned. Now, for you as employees, there are going to be some significant changes a lot of you are going to feel from a tax standpoint, effective 2013. A lot of the new taxes were tied to healthcare reform. But in particular, for those of you that haven't already realized it, if you've got a flexible spending account, you've noticed that the caps on that have been reduced to $2,500 for the healthcare side of it. Additionally, there are some rules that have been changed with respect to health savings accounts, additional Medicare tax, as I mentioned previously, on unearned income, investment income that hit in 2013, 3.8%. The last bullet on there is something called the Class Act, which if any of you have heard of this, this was supposed to be the long-term care arm of the bill, and it's actually been repealed. So we don't have to worry about that anymore, which frankly is a good thing because, well, most of the law I think you could characterize as a fiscal train wreck. Its own author, Senator Baucus, referred to it as such. But you've got a number of things within the Class Act in particular that were just untenable. Now, the exchanges or the marketplaces, you're going to go there. It's going to be like an online shopping experience. Bronze plans are going to be the minimum. You're going to have a bronze plan or you're going to get penalized. A bronze plan is going to cover 60% of actuarial value, so it's going to be essentially a $2,000 deductible, 80% coinsurance, $30, $60 copays for general practitioners or specialists, and out-of-pocket limits could be up to around probably $8,000 or $9,000. So pretty significant out-of-pocket cost for a bronze plan. If you want to pay extra, you can get silver, gold, platinum, and if you're under the age of 30, there's a catastrophic plan available to you. Now, one very important thing, this isn't my speculation, the IRS actually has predicted that in 2016, the average cost for a silver plan, that's this one with a 70% actuarial value for a family, is going to be around $20,000. So I guess you be the judge as whether you think it's going to be less expensive, but the IRS certainly doesn't think so. Now, why is that? You're going to hear a lot about community rating, and community rating is something very dense. Actuaries have loved talking about it, but rarely has it come into discussion with the general population. The way insurance plans are written is there are rates that are based upon the risk profile of the population, and those rates are going to be increased to the extent average age goes up, tobacco use goes up, people are sick, those sorts of things. So in 2014, community rating is going to change, and it's going to be significantly different than it has been in the past. As I mentioned, insurance carriers are no longer going to be able to discern from your health history what kind of a risk you are. So they are only going to be able to use a few things to price your plan. They're going to be able to use age, but they're only going to be able to have a ratio of 3 to 1 between the youngest, cheapest age rate and the oldest, most expensive age rate. Okay, I'll talk about what that means here in a second. For tobacco use, there's going to be able to be a 1.5 to 1 factor. So if you smoke or use chewing tobacco, your rate could be impacted 50% more than the person who didn't. Now, your family composition can still be used to rate it. All that means is there can be employee rates, family rates, employee spouse, child, similar to today. And there will be limited ability to rate based upon geographic areas. So the two things that are really going to cause healthcare costs in the individual market and the small group market to go up so significantly is the tobacco use, which is only going to be limited to 50%, as I mentioned, and then most significantly, age. Right now, the insurance carriers use probably 12, depending on the carrier, 12 to 15 different tranches for age rating. So if you've got a small group that has a bunch of 20-somethings or 30-somethings, you're going to have a significantly lower rate than a group that has older employees. Well, what community rating is going to do, as I mentioned, is there's not going to be able to be more than a 3 times difference between the youngest and the oldest age rate. So what the carriers are having to do is they're having to force up the lower age band cost in order to maintain, essentially, the upper age band cost. So it's going to make costs go significantly up for younger folks, which frankly leads a lot of people in our industry to think that the uninsured issue, a lot of which is younger, healthier people who don't think they need insurance, it isn't necessarily going to change a lot of that, which was part of the argument around pooling and everybody's in. If you can't talk those people to be in because the rates have gone up and because the fine's so small, is it really going to change much? Now, predictions. I've already mentioned a couple of them. Premium impacts, small group and individuals are going to see rates go up significantly starting January 1 of 2014. Strategy to that is maybe try to lock in your rates for December 1st, or if you've got a small group plan, ask your insurance carrier, your broker, to get you an early renewal on December 1st. Taxation adjustments. Needless to say, I think a lot of you are probably familiar with some of the changes that are coming into place with taxes. I think if you look back at the unfunded liabilities on Social Security, Medicare, and just listen to some of the discussions in Washington, you're going to see significant tax adjustments here in the future, in large part to offset the cost of this, because the subsidies, I mentioned briefly, anyone with incomes, family incomes of less than 400% of federal poverty level, they're going to be able to go to these exchanges and get tax subsidies to lower the cost of the care. Now remember, I said that the average cost for a silver plan, according to the IRS, is going to be around $20,000. So you're going to be coming down from a much higher number. If you want to fill it out, this is what the proposed application is going to look like. It's 21 pages long. So if you enjoy filing your taxes, you're going to really enjoy applying for insurance. There are going to be some tax subsidies depending on income. For employer predictions, it's really become a compliance issue for employers. As I mentioned, most of them that we counsel with are trying to make sure they avoid penalties. In the majority of the cases, what that looks like is employers are going to keep offering coverage, but they're going to increase the cost to where they can to avoid penalties. They're going to reduce the benefits to make sure that they can keep that cost within the parameter of those essential benefits they now have to offer. And essentially by doing that, what it does is it makes the exchanges irrelevant to you. So for those of you that raised your hand and said that you currently have access to employer-funded coverage, assuming that your employer continues to offer it, regardless of your income, you're not going to be able to get a subsidy through the exchange. So it's setting up a very interesting dynamic in which employers are wanting to offer coverage now to avoid fines. Some employees, especially lower income employees, are going to want their employers to drop. But the employer isn't going to want to drop because they don't want to get hit with a massive penalty. So they're going to offer minimum coverage, hope the employee can't afford it and opts out, and you're going to have a lot of underinsured people out there. So that's about that. Again, I said I was going to try to make this positive. I don't know that